right now. Lynn Budd with the Wyoming Department of Homeland Security. Thanks for joining us for this, Lynn.
Thank you for having me.
So let's first off make sure people understand the difference between the Federal Office of Homeland Security and what they do and what the Wyoming Department of Homeland Security does.
Well, our Office of Homeland Security is mostly emergency management. We do perform some functions similar to the Department of Homeland Security at the federal level with regard to looking at threats to our state and cybersecurity and all things like that. But really, mostly what we do is support local jurisdictions in emergencies.
Okay, but in a case like this, dealing with a pandemic, were you guys geared up, or did you see something like this coming? Was this anything you'd ever planned for?
Oh, absolutely. We have plans for everything. And, of course, the Department of Health has their pandemic plan, and a part of their plan, we're supporting them. That's our job, is to support state agencies and local jurisdictions by coordinating other state agencies and federal resources.
Okay, so you're the place where everybody goes through to find out what they should be doing when. Does that include on the local level, like at local hospitals?
Well, we coordinate with them on a daily basis, and we are working in a unified command structure with the Department of Health. And so that's the same thing that's happening at the local level. Our emergency managers at the local level are working with their public health officials there, and we look at what resources they might need and see how we can help them out.
Okay, let's talk about the exchange of information then, because some of the information, I would guess they would just pick up the phone and call you, but how do you organize the exchange of information and then the exchange of the goods that they need?
Absolutely. So we do have a resource ordering system so that we have it automated. They can send an order to us. That doesn't necessarily mean that we'll be able to supply them with everything they need, but that gives us an idea of the need as far as resources are concerned. And then we work in conjunction with actually other state partners, including the Department of Transportation and other private partners, to help get those resources out to them in a timely manner.
I'm talking with Lynn Budd. She's the director of the Wyoming Office of Homeland Security. Dealing with coronavirus in the state of Wyoming, Lynn, can be a bit different than some others. Imagine what they're going through in New York City right now compared to what you're going through way out here in Wyoming. But your needs are different. Okay, so we're not as packed in. But that means there's some communities out there that are way out. How do you deal with the communities that are way out and very small and almost off the map?
Yeah, absolutely. So, I'm glad I don't live in New York City right now, that's for sure. Those communities are supported from the county level, and again, it's just kind of a cascading thing, upwards, if you will, or downwards, either way. Everything starts local and ends local, so they coordinate with their local health department and with their local hospitals, and we supply things to the county level and then let them distribute things as they see fit in their county.
And Director Budd, I'd like to ask, what are some of those things you're distributing to the counties? I mean, it sounds to me like a lot of sample collection kits and PPE.
Yes, you're exactly correct. Those sample collection kits, as you're talking about the distances, it was pretty amazing to see the coordination and hard work of people. We actually distributed those to everybody in the state in one day. So that was exciting for that. Wow. Coordination. In addition, we have a stockpile of PPE in the state, and we've distributed part of that, and we've received some distributions from the Strategic National Stockpile. We've distributed 27,100 N95 masks, 34,450 surgical masks, 24,400 gloves, face shields, and isolation gowns. So.
Okay. That's a lot of work. And when it comes to working with the feds to procure some of that stuff and get it distributed across the state, what's that process like?
Well, because we have two major agencies involved, HHS and FEMA, it's an interesting coordination because some of it does come through HHS, but our side, because the governor and, the president declared a disaster for the whole nation, that comes through FEMA. So we coordinate through them, and then they coordinate through their federal partners. Their job is the same on the federal level as ours is on the state level. They coordinate federal resources in support of the state.
And you feel like the feds have been responsive and are working to get you everything that you need for Wyoming?
Well, they are having to focus because of supplies. They are having to focus on those hot areas first. We are getting shipments from the SNS, and we'll be distributing another shipment this week from the SNS. But that's a limited supply, and it's just meant to be a stopgap until manufacturing can catch up. So then we'll work with FEMA. We've already got orders into FEMA, so they're in the queue, and we're waiting to see how those will get filled.
I'm talking with Director Lynn Budd. She's with the Wyoming Department of Homeland Security. This is a special edition of Town Hall Wyoming Coronavirus Live. So let me ask you, since you mentioned the hotspots, let's talk, for lack of a better word, triage. How do you decide what needs to go where?
Yes, we make sure that every county gets a shipment, and then we did add some additional resources for those counties in the last shipment that had a case in their county, which was just a few at the time, and now I believe we're up to 15.
But the amount of equipment and sample collection kits, that sort of thing, that you're distributing right now, you're able to be preventative with some of that distribution in counties that maybe aren't seeing a high concentration like Fremont County, for example.
That's correct. So we want to make sure that every county is prepared, because the likelihood of it being in every county in Wyoming is pretty high.
Absolutely.
Okay. So out of the materials that you are bringing in, what do you need?
More.
Okay. Yeah, more of everything, basically.
Mostly the masks is the issue right now, and the test kits. Our state laboratory actually made the last test kits that we distributed. So instead of getting them from the federal level, there's a recipe, if you will, from the CDC that they were able to use to do that. So we're trying to be really innovative. This is a very unusual situation. It's not a flood. It's not a fire. It's very different, but it's also very much the same. It's a response.
And so if there's anybody who's sitting on a doomsday stockpile of masks, or somebody through industry maybe has the hookup, they should get in touch with your department and see about getting that distributed.
That would be fantastic. Yes, we are receiving some donations already, and also receiving some information that there may be cash donations coming as well that will help us to purchase more.
That was a great question, because I was just about to go there. The people in Wyoming can be very innovative, and there are some people who are actually making masks and other things that you might need. So if they have something, from the cash to maybe materials they can make for you and send to you, how do they do that?
Yeah. Well, at first I would suggest they work in their local community. They need to support those people first, but if you do have a lot left over, they can get a hold of us through our website, or email our office, and also our duty officer phone. So go to our website, which is hls.wyo.gov. And then we also have, from there, a website that has all of the latest statistics and information on it that we've collected from other sources and connected with other state agencies, which is wohs.us.
Now, on that note, since you're all coordinating and working so hard, and I can believe that this is a lot of overtime hours, so where are you working from? Are people at the office? Are you spread out? I just got a few seconds for that answer.
Yep, we're trying to do our social distancing as well while we work together in coordination.
Thanks for all your work, Director Budd.
Thank you.